Yes, I did it. Usually I ask all of my attendees to repeatedly say, record, record, record till I start, because I always forget. So I'm glad now that this will be documented, this unknown conversation of whatever direction it goes in. I did not tell Bizline that I was bringing you on. For those of you who listened to the past on the podcast that we did on nutrition and mental health, I had Dr. Catherine with me. And that was a very fun podcast, which I don't even know if it's still up anymore, but I think it's in the Facebook group. So no. So if anyone's interested in nutrition and mental health, we can revisit that. And we can always have a different conversation on that and bring, new faces in and talk about different concepts. But today we are going to be talking about self-care, which I hope is a conversation that a lot of people wanted me to cover, because I think it's a really big buzzword that gets thrown out on social media and like even just in the world. People will be like, well, are you like taking care of yourself? And it's like, what does that mean? I think that people there's the definition of self-care where it's like hygiene, and then there's the self-care where it's been glorified as like beauty. And I don't think that a lot of people are talking about the nitty-gritty details of what self-care is when it comes to anxiety and depression, because this is it's a dark place, right? And when we're saying self-care, the definition isn't like, what are you doing to make yourself feel good in the moment? It's like, what are you doing to actually improve the experience you have of your mental health condition, right? And I did a little quick story today on Instagram where I was like, I'm doing my self-care. And I did the quotations in the air, and I was like, self-care is not the things that you like doing. It's the things that you have to do. Otherwise you will fucking drown. And Bizline's never been live with me before, so she doesn't know that I'm like the F-bomb queen. I will throw out all the swear words. I'm in my PJs right now. I love it. We are chill in this community. So expect the swear words coming through. If you are live with me right now and you're listening, you've never heard me talk before, welcome. I'm Dr. J and I swear a lot. These two definitely won't. They are way more well-coiffed than I am. But yeah, let's talk about self-care, just straight up for anxiety and depression. What comes to mind right off the hop for you when you're like, okay, if I had a patient in front of me, or if you're talking about yourself, what do you do for yourself that constitutes self-care or sits in that category for you? Either one of you can take the floor first.
Go for it, Bizline.
Yeah. For me, and, this is something that I work with my patients is, like you mentioned, Jenna, is that, anxiety, depression, very heavy, dark conditions. And it's often really difficult to even do daily little things like getting out of bed, brushing teeth. And, those can seem like really big, overwhelming tasks. And when I talk about self-care with my patients, I really just talk about just for me, it's about finding little pockets of time for yourself during the day, right? Whether it's just literally even taking a minute during your workday to just look away from your computer and just taking 3 deep breaths for yourself. That is self-care. And I think when it comes to self-care, we have such a distorted conception of it. And we think it's about, taking 5 hours for yourself, doing a hot bath and glass of wine and
don't talk shit about my hot baths. Okay.
No, I love hot baths too. But I think then we just get it so confused. And then that actually keeps so many of us from doing self-care. And it's about really changing up what self-care means. And it's literally making time for yourself during the day. That's literally as simple as that, right? Whether that be you make time for yourself by washing your face, or whether that be you make time for yourself by doing the whole hot bath, wine, whatever it is thing, right? And so, yeah, so it's just, I think that's what comes to my mind. And, when I work with my patients, I'm all about simplicity, keeping things as simple as possible. Are you able to make even 5 minutes for yourself during the day? Great. You did self-care, give yourself a pat on the back. So that's what comes to me when I think of self-care.
Yeah, I am totally on the same page. I love that. I think it's all about simplicity. And also what works for that person too. Because Jenna loves her hot baths, and I can I barely eat during the day because I'm so freaking
she gets hangry.
Sometimes I won't go to the bathroom for 5 hours. And I'm oh my God, this is the problem. So
this is the problem. I've narrowed it down. I've held in my urine for too long. That explains everything.
And I haven't eaten. So yes, I love that. I think that's so important, and to tailor self-care and just really have a discussion with people about like what works for them. But at the same time, like I agree with Jenna too, in that like the word self-care is just such, for me, like I just, I know,
I cringe every time I hashtag self-care in like a thing. I'm like, ugh. Yeah. And okay.
So like for me, like I think it's like the little things, like Bisleen said, like throughout the day, like just taking like a couple minutes, like the tiny little moments. But then also it's like the big thing, which for me is like therapy and having someone holding me accountable and like helping me, you know, deal with my things and talk about things and call me out on my shit. And Jenna is amazing at that. And like, you need someone like Jenna, you know, like to help you work through your problems.
Yeah.
And, you know, I think that is a huge component to really, taking care of yourself and like taking care of your mental health, having that coach, that cheerleader, that doctor, that naturopath there on your side who you can actually talk to and like be really candid with. But then also take those small moments throughout the day, you know, when you are by yourself to take care of yourself.
I want to break it down right now, and we're all going to share, or at least I'm going to share my things that I do, and you guys can feel free to share yours that you do too. But we're going to talk about the things that constitute as self-care that you enjoy, that you put into your schedule because you're like, okay, I do this because I love it. It brings me joy, all that kind of stuff. And then we're going to talk about the things that we do that we don't like doing, that are necessary and required for us to maintain our mental functioning. People in my community very well aware and know that I work through anxiety and depression. That is something that I will be working through for the rest of my life. It is something that when I work with my patients, I say to them the exact same thing. This is not something to be fixed or cured. It's something to be worked with. And that is a long-term life lesson that you have to carry with you so that you understand how you're going to manage and in a positive way, manipulate your life so that it ends up being what you want it to be. Because there has to be safeguards in place for us to be like, okay, here's my checkpoint. This is why today or this week or this month or this year was good for me. And this is why it was bad for me. And this is what helped me grow. And this is what pulled away from that. So I think it's just a good, you know, place for us to organize. So talking about your timing, you know, Bisleen, you just brought that up, is take the few minutes throughout the day. And it reminded me of something that I do for my self-care, which I've been talking about this week on my social media. And it's that I time block. And the way I do it is like, I am a non-functioning person before 9, 10, 11 a.m. I am a non-functioning human being. If you want to see depressed Jenna, wake me up in the morning. If my husband was within an earshot distance right now, he'd be like, yeah, we don't speak before 9 a.m. There is no talking because things don't happen well before 9 a.m. And that's something that I've built into my life, which is there is nothing in the schedule. That time is open for me to be in a bad place or an anxious place or a frustrated place or a fatigued and tired place with no judgment. And that became a part of my day where if someone says to me, can I have an appointment at 8 a.m.? I go, absolutely fucking not. Right. I had one of my patients booked in last week and he was like, yeah, like we're going to do 9 a.m. And I was like, shit, better wake up an hour before I do that to make sure that I'm me before I get on the camera. But that is something that I've incorporated into my life. And if that sacred space is taken away from me, that is not a non-negotiable for me. I told you I was going to do this and he is legitimately barking into the mirror. What did I throw my arms up too quickly for you, sir? All right, Otis, everyone knows you exist. Come back. Okay. So that is my sacred time, non-negotiable. The same way that someone else goes to the gym for their mental health. That is shut the front door. Every single day I get that time. And, you know, I've heard a lot of patients or even people in general say, how do we remove the guilt of not getting out of bed in the morning? How do you just get up and do things? And I say, well, maybe in your schedule, you book half an hour for nothing, to do nothing, because then you succeed at the thing you're setting your mind to, which is if I don't want to feel guilty when I get out of bed, because I feel anxious of leaving my, you know, bed to get to do something, or I feel like a bag of shit because I didn't get out of bed to do the thing I needed to do. It's like, you've actually achieved what you wanted, which was space in the morning. Right. And when you flip that mindset on its head, that actually becomes this beautiful time in the morning where I get to look at myself and say, I feel this way and that's okay. Not I feel this way and I have to do this, or I feel this way and I have to attend to that. That's my time. Right. So there is the morning time for me. Do not scratch your bowl. I fed you a full meal. The morning time is for me. And then there's also what I struggled with as I got older was evening times are for me, to do nothing, to chill, to let go, to do that. I used to be like, go, 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 go. And then would be like, okay, please, peace be upon you, sleep. And it wasn't working because like I had there was no wind down in the evening because I felt like I had to be achieving things. And when I shift my mindset to like, you now need to achieve chill in the evening, I was like, oh, what a weird concept. Right? You can flip that. So I think time blocking for me, scheduling has become a form of self-care, and it's created boundaries around where my anxiety and my depression is allowed to go and where it's not allowed to go. Right. And I think that this is it's like an under talked about thing, because you go to work 9 to 5, you do your thing, you come home and you're like, now I got to do laundry and I have to make food and I have to do all this. And it's like, I don't know anyone who has in their schedule, thou shalt chill between 9 and 11. Do you guys have that?
Girl, hell no.
I'm a morning person, so I definitely don't have that. I love the morning.
So, well, do you have time in your schedule where you devote nothing to do nothing?
Mm-hmm. Mm-hmm.
Yeah. And then I think that like most people are like, what are you talking about?
Yeah.
All the time.
Mm-hmm.
And I'm like, okay, like there's where some work needs to be done. I used to be scheduled from the morning until the night. And I was fine because my cortisol was so high all the time that I was like, I got this. I can do this. I can keep going. Everything's good. Everything's fine. People will be like, aren't you stressed? And I was like, no, what are you talking about? Everything's fine. And then I guess the pandemic happened. And someone was like, stop. And I was like, douche, right? Your body just kind of like, it breaks when someone says to you, okay, now you have time to chill. So that was very interesting. That's something that I started incorporating the past 2 years, which interestingly affected my cortisol levels immensely. And I think Catherine was able to actually watch me go from like, go 3,000 to turning my mindset from that to actually being able to sit inside myself and be like, ooh, there's icky things happening in here that I'm not paying attention to because I am overdone, overworked, overthought, overscheduled, overgymmed, over yogaed, over meditated. Like there was like, blah, 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 blah. And then when I kind of looked at it and I was like, that's weird. And then I say it to a patient now, I'll be like, what about this? And they're like, that's weird. And I'm like, just do it. And it just changes the perspective a little bit. So that's something big for me on a self-care front, is that time blocking. What about for you guys? What's like a huge thing that you've done where you're like, whoa, I didn't even think that was going to be helpful when you did it?
You can go first.
This is going to be embarrassing, but it's like just eat regular meals.
No, that's actually a real big thing for you.
I'm not a psycho.
Yeah.
But like, these are like little foundational things, like work out. Like I need to go on my bike rides, like to work. Like I love bike riding. So that is like my exercise, eating properly, like having my smoothies, making sure I'm eating consistently throughout the day, putting on some makeup, like feeling like an actual human being and not a zombie.
What's that?
Yeah.
What's makeup?
I mean, whereas Jenna is just like, oh my God, naturally like, I people are always like, if I don't wear makeup, they're like, are you okay?
You look tired.
You look tired. Are you? I'm like, no, I had like the best sleep of my life. Thanks. But anyway, I'll just go put on some mascara now.
You look great.
Thank you. But yeah, there are the basics. But for me, and I'm still like working on this, is like reaching out to people to help me like to connect. because I am one person that will just like be on my own, lasered in, like zero, like totally focused. And I will like forget to connect, and I won't, take that time to build those relationships. And when I do, it's like, oh my God, that's what I needed. Like I needed that connection. And I know we're talking about self-care, and that's it can feel like a very selfish thing. And so at least for me, so like I'll push it out to the people around me to like bring them in so that I feel like it's not just all about me, like I'm building those connections too. And then, yeah, like therapy has been huge for me in terms of self-care and just like calling me out on my shit, holding me accountable, and like helping my crazy anxious brain work through things. Like this week, like my anxiety has been through the roof, and I'm like, what the heck? And I realized the days, like maybe like 3 to 4 days after my period, I am like a basket case, and I don't know why. It's crazy. And so what I've done now is like, I'll make my self-care routine a little bit heightened. Like I'll punch it up and I'll be like, all right, bath tonight, call my friend the next night.
Yeah. I don't know. You like put your safeguards in place before. You're like knowing that it's coming. You're like, I do the same stuff. I mean, this is only relevant for the women that are going to listen to this.
Yeah. Sorry.
But like 4 days before, I will actually have a countdown. And like on the fourth day before, I will actually look at my husband and go, by the way, you know, if anything happens in the next 4 days, this is what's responsible. And then there's a shift in how you approach things, which is a type of self-care, because I think if you're not aware of that kind of stuff, you can really start to take it personally in your brain and pathologize yourself and be like, oh God, like, you know, my anxiety is out of control and I'm a bad person and I did this and now my relationship sucks. And then like you like bleed and you're like, whoa, whoops.
I feel good now.
Yeah. It's always after the fact too, right? Which is so funny too, because then you'll be a little bit
there's no perspective
for a few days and then the blood will come. You're like, oh, that's why. And every month it'll repeat and it's the same thing. Yeah. You'll understand that it's a pattern, but it's like every month I'm always surprised. Like, oh, okay.
And my husband laughs and he'll be like, are we on the fourth pill before it happens? And then I always look at him, I'm like, you're such a dick. And then I look and I'm like, fuck. But yeah, that over time, obviously, the more you deal with that kind of stuff, it'll start to make more sense. So for me, you've got time blocking. For you, it has been reaching out to others and connecting to make sure that you're like mentally well on a pillar. Like that's like a pillar of health, and also food for you, food and hydration. You're like really big on. I'm gonna add a few more of mine in. I want to hear from Bisley, and I want to know what she does as like self-care for her mental health. I don't know if you actually struggle with anxiety or depression. We did not get to cover that, so I don't know what you actually do for yourself in that regard.
Yeah, I actually have. I suffered from 5 years of chronic depression when I was a teenager, and then I would say I still battle with anxiety. That's just, it's a friend that just, you know, comes.
Everyone aboard?
Yep. So
gotta love it.
Yeah. And so, I mean, for me, my self-care, what I've developed over the years is just my mornings are just so key for me. And the way I just see mornings, if you have like a day, right, it's literally like the foundation. If there's like a house that's like a day, the foundation for me is like the mornings. And I've noticed such a big difference in myself when I like at least give myself like an hour and a half in the morning. And I am all big on like journaling, exercising, meditating, you know, like it just works so well for me, and I'll rotate between those things. But I find that if I don't start my mornings off with that, like the whole day just goes to shambles. It feels like I have less control over my emotions versus when I start off my mornings by doing the things that bring me joy. And that's something I teach some of my patients too, especially the ones who feel like it's difficult to get out of bed and things like that. It's like, let's look at your mornings. Why don't you put something in your morning that makes you excited to get out of bed, or something that you just enjoy doing? And when you just start your day off by doing something you love, it's just, your day's already off to a great start. It already seems like a great day. Right. Mm-hmm. And then I've noticed that too, that during my day, when I have a good morning too, if things go, you know, get messy as they always do, because that's just how life is, it's just so much easier for me to bring. right? It's just so much easier for me to bring myself back to a good place because of the foundation I set myself off with in the morning versus like when I just start my day off like rushed and just I jump into work or something like that.
Yeah. I think we end up in like an interesting spot when it comes to depression, like especially the dysthymia in people. Like my dog is about to knock over a houseplant. Your life will be so far gone. I wish y'all saw that. Whatever just happened over there was 10 out of 10. When we're working with people who have that lack of enjoyment or the lack of desire, and then also have the anxiety at the same time, it's like, they're like, well, I don't like anything when I get out of bed. And then they panic because they don't like anything. It's an interesting spot to be in. And that's where when I work with people, I do the non-negotiables. When it comes to that. And, I look at them and I go, I don't care if you like it or not. And if any of my patients are listening right now, they're like, yes, she's an asshole. Yeah. I don't care if you like it, you do it because it brings you what you need after. That's like saying, I don't want to go to the gym because I don't want to, like build a tricep. It's like, okay, well, you're not getting the tricep if you don't go to the gym. So, right. And it's like we lose the concept of our brain when it comes to that. We're like, well, I don't want to make myself unhappy by doing the things that I don't like because then it's going to stress me out. I'm going to get anxious. And I look at them like, I don't give a fuck. You're going to get up and you're going to do the thing that you committed to doing. And you're going to stick with it for a week, 2 weeks, 3 weeks. I just punch the table, 4 weeks, however long it takes to get there. And then we start to see the shift, and that shift builds momentum. Right. And I guess that's the part of self-care where it's like, it's not something you enjoy. It's something that you do in order to make it happen.
It's a combination. I think it's a combination. Yeah. It's like some things you enjoy, some things you don't. Some things are like you're dragging your feet. You're like crawling through like the thick, gross mud. You're like, ugh. But then some things are like, yay, I love it. And you feel great about yourself. And then,
Yeah.
Also, can I just say one thing?
No.
Okay. Well, I'll say it anyway. Social media.
Yeah.
I think that in the mornings, take a break. Don't go scrolling in the mornings because I find that just like heightens my anxiety. And I think it's like to be aware of, when you go on social media, you take a look at like all the posts and stuff. If you start to get anxious, maybe you need a break.
What do you do in the morning? I mean, I reach for my phone. I play Wordle and Dordle and Quordle.
I don't look at my phone.
It's become a morning thing because I have the time block at the beginning. I get, so my alarm goes off half an hour to 45 minutes before I have to do anything because my body is like a slow engine. I could fall asleep. I could stare at my window. I'm not going anywhere fast. I've now gotten into a routine of looking at my dog in the morning, who's staring up at me, being like, Ma, let me pee. And I look at him and I go, good morning. And I do that 20 times until I build enough energy to step my feet out of bed. And it's like the most hilarious thing because like, what a weird thing to get you up out of bed. But because I have him, I now have to go outside and sit and get like the sunlight on my face. And then I have a purpose. And I did talk about that a lot this week, just like purpose when you get up, whatever it is that you need to build purpose around, like build purpose. Even if the purpose is like connecting with someone, like what if I said to you, like every morning you need to call me, and like it became a purpose that you had to fulfill, but then you would have someone holding you accountable. I mean, unfortunately I have a fuzzy creature keeping me accountable right now. But getting outside, getting the light on your eyes and doing that kind of stuff really is going to help kickstart the morning. Something else that I do, let's just like pivot for a little bit because we're like really big into routine right now. But something else that I do as a non-negotiable is walking. I have a coined term that I say, shift your mood by shifting your space. And you really don't know how shifting your space or going on a walk is going to make you feel until you're 15 to 30 minutes in it. And I just talked about it with a patient the other day. You don't have to enjoy it. You don't have to go out there and be like, I love walking. I feel amazing. You need to get out there and be like, I feel different than I did before I left the house. If that built energy, if it took you on a roller coaster of building it and then dipping it, if it made your skin feel different from the temperature that was inside the house versus outside, if it was the change of your pupils because the light shifted and now there's a different experience for you to tap into. I always say that to people, is like, walking is such a pivotal, critical thing in my routine, and it is a non-negotiable. When there is a day where I haven't walked, I actually feel uncomfortable in my own skin. And I can't describe it. And it has to be, for me personally, out there in the woods, which is why I live where I live. And it's always been a part of my life. Ever since my mental health was such a big player in all of this, like getting outside and being beside a tree was the only thing that ever saved my life from a fundamental perspective. And it has become a part of what I do every day. Even if it's just going out there and breathing. We don't have to sweat. We don't have to power walk. You just need to shift where you are to have perspective. And I think that right now, I guess some of us are still connected to nature, but I think a lot of people are not connected to nature anymore. And they don't have a profound experience when they see a leaf. And I look at people and I'm like, how are you not having a profound experience while looking at a leaf? And I think that it sounds crazy when you say it, but when I work with people in my program, I'm like, we do a module on nature and mindfulness and how to start incorporating these things and what we're missing that's right there in front of us. How are you going to feel purpose outside of yourself with something that you can actually go and touch, something very real? But we do activities around that. And it changes how the brain functions. And people don't like to think of this as like self-care. They're like, oh, I went out and touched a tree. It's like, okay, but what are you touching the tree for? What's happening when you do that? You know, like there's like girls out there on Instagram being like, hug a tree. I'm like, for what though? Right? What are you doing when you're engaging in that activity? Because that changes the type of self-care that you're engaging with, right? It's not being outside, it's how you're being outside. And I think that we need activities to relearn how to do that because our brains as animals are primed for that. But as human beings with a frontal cortex, we're not taught how to use that muscle. So our bodies are doing things like anxiety and depression where they're having physiological reactions and we don't have any skills to cope because no one ever said to someone, I want you to go look at a leaf and count how many veins are in it. I want you to put your fingers on both sides of the leaf and slide it up and down and feel what that's like, right? An animal, when I take my dog out for a walk and he's anxious, he starts ripping through hay. He's like down in the grass, chomping on it, like rummaging his feet through it. And we're forgetting that our brains actually have the same middle brain and functions as animals, but we're sitting out here being like,
You know, I think you also just talking about this brings up such a good point too, is that, you know, everything that we're talking about and the big things, it's the simple things.
I know,
you know, it's literally the simple things like going on a walk, looking at a leaf, right? Eating and making sure you're eating enough times during the day and urinating when you feel like urinating, right?
But you know what
and
it
I
is
think
though?
That's a big thing too when it comes to like self-care that I think sometimes people like overcomplicate it. And I feel like that's such a recurring theme here. It's like, it's the simple things that make the biggest impact on your mental health. You know, I remember with breathing, right? When I was going through my chronic depression, I was like breathing. I was like, are you kidding me? Like, this is absolutely ridiculous. It's stupid. And I'm going to freaking sit here and like meditate for 10 minutes when I can be doing
I breathe every day.
Exactly. I'm just like, why am I going to, you know, breathe any different?
Where are my patients at? Where are my patients at in this live right now? Breathing, huh?
Yeah. And then you do it and you're like, whoa, this is great. And now breathing is one of my non-negotiables, and the deep breathing is what I'm talking about. But
you can breathe and make your skin feel different.
Yeah.
Right. And I've become like a little bit obsessed with like skin sensations this week because I've been talking a lot with people like how to like snap out of this stuff. And skin sensations are huge, right? When you can feel something, it's like, it's a full scent. The same way that eyes see and nose smells and tongue tastes. And like we forget about the sensation of touch and how powerful it actually is because you can feel what's going on inside your body, but you can't see it. You can't smell it. and you can't tangibly, you dog, no dog. But you have to only feel what's happening inside your body. So it's such a scent to tap into. It was very spiritual of me. I see. One of the people I'm working with right now is like tree and leaf therapy. Yeah, man, it works. But you know, the important thing, and this is something that I'm I have a hard positioning on, is it matters the lesson that you're learning from the person you're learning it and the way it's delivered. If someone like randomly was like, oh, Jenna, like go stroke a leaf, I'd be like, you're whack. Right. But it's about the experience that you personally get when you engage in an activity with something that changes your perspective on it and teaches your body and your cells at once. Like, boom, that's the lesson. It's different than like going on a blog being like, you should ground your feet in earth every day. Right. It's like, okay, like someone goes outside with bare feet. It's like, okay, I walked on the ground, I walked off the ground. And it's like, yeah, we know in research that actually can lower cortisol. That's great. Right. But are you going to get people to get outside and walk on the ground with their bare feet and step outside if there's not a lesson to be learned when they're doing it? And like, I work with people who are very intellectually inclined. They're like high thinking people, like high achieving people. They want to know their whys. They want to be motivated. And I think it's hard to motivate people when they're not understanding why they're doing what they're doing and you don't have them in an immersive experience about it. Which is why, again, like I know you love journaling, Bisleen, but like for a lot of people, it misses the mark because people are just filling out prompts being like, yeah, I feel good today. Or like, this is why I thought that. And that's why I felt this way. And like, when I work with people, I'm like, okay, I'm glad that you did your journal activity. You're going to bring it. And we're going to go like 10 layers deeper. Because writing about your feelings is like one thing, but understanding your patterns is a different thing. Thinking positively is like, you know, it can be helpful for some people, but for most people with anxiety and depression, it misses the mark completely. So when it comes to self-care in that category, I think that we can have a nice, healthy debate. I do want to at least finish what the heck we were trying to talk about at the beginning, which is what are the things that we do that are non-negotiables? So mine are, you know, walking, getting outside, and then we devolved into our nature spiral there. Meditation is huge for me. We can have another debate on that. I would love to have a debate on that. Breath work is huge. We probably won't have much of a debate on that one. What is something else that is a non-negotiable? Oh, for me, coffee. So many people are like, I can't drink coffee because I'm anxious. I'm like, yeah, been there. How many times have I called you, Catherine, been like, well, that was one too many cups of coffee and I don't feel very well right now. And there's something happening inside my soul and I don't like it. But that is a part of my self-care routine. The hot baths, I know we joked about at the beginning. You know, those are it's something that's so a part of my routine that it's like a part of my identity. Like I have purchased an expensive bath for me to sit in my home because it's so much a part of something that I do, not because it relaxes me. It is something that brings a different sensation. It's like, oh, this water is hot. I'd like this water to be warmer. Oh, this feels interesting when I blah, blah, blah. Now I can put magnesium in it and have it soak into my skin and actually impact my mood and my feeling when I exit this bath. I can actually feel more relaxed because, you know, for people who don't know that Epsom salts are magnesium, warning, it is going into your body, straight into your bloodstream through your skin, right? So there are ways that you can manipulate that. 2 months ago, I think it was now, I did cold baths and I went into that goddamn cold bath every single day, okay? It was 4 degrees. I swear, I kid you not. I would put the meat thermometer inside and check the temperature, and it would be a way to stimulate a sensation inside my body that was different. So there's a lot of ways that temperature and water can do that for the nervous system, which is pretty cool. What are other non-negotiables? Catherine, you know, you watch me live my life a lot. Things that I do that are a part of my schedule that are
sitting in the sun.
Yeah, she's a sun warrior. Yeah.
I think
don't judge me for that, guys. I do love sitting outside. I love me a good tan. I may have a tan line already, and it's only May. But yeah, that is definitely something I like to do. I would say The things that I don't like to do that are self-care related are, yes, chores and the basic stuff like that kind. Yeah. I don't even want to go there because, you got to do what you got to do when you're an adult. But there are things like that I know are going to be impactful for me, like sitting down for meditation, like slowing down, like letting go. Something for me, and I know I talk about this quite frequently with people in my community, is there's like physical symptoms of anxiety, and then there's emotional symptoms of anxiety and depression, like the mental stuff versus the physical. And I think over the years of doing all the CBT and doing the work and understanding how your brain functions, you have to resist your urge to fall into patterns, which is really, really, really hard to do. So let's say you're engaging in conflict and, you really want to prove your point. Like that's a thing for me. It's like proving your point is pivotal. If you don't prove your point, you're a failure. If you don't prove your point, you're not good enough. You're not heard. You're not understood. That's a mental symptom of something that people who have anxiety and depression might work through, right? So when I'm in conflict, I actually have to resist my urge to give into my natural inclinations and my patterning so that I am practicing self-care, so that there isn't emotional destruction that's occurring, that there's not symptoms being taken away after that, like emotional and mental symptoms. So that's an interesting type of self-care that I don't like engaging with because it's against my natural urge, which is to be who I am. But we have to pull back from that and not be that because it actually objectively isn't good for your mental health or the situation at hand. That was an interesting, deep one. As my dog munches on my husband's shoe beside me. Get him, Otis. What else? I mean, Catherine, you said you go to therapy, but you like it.
Did I say that?
I love therapy. No. I love being called out for my bullshit.
No, I don't. I hate it every time. Like the day of, I'm like anxious. I'm like, I'm going to cancel. I don't want to do this. No, I don't like it. But I force myself and I recognize that pattern. And I know that at the end of it, I am going to come out a total mess, but so much better because I'm working on my shit. And the more I can see my patterns and try and work through them, the calmer I can be, the less anxiety I have. The more I can almost like work with it and like recognize it and move through it instead of getting stuck.
View objectively and create solution moving forward.
Yeah. So, I mean, I don't know anyone who likes therapy. If you like therapy.
I do.
What?
I like therapy too. Yeah.
Get out of here.
Yeah. I love it.
Maybe my therapist is an asshole, but like,
come on, you don't like having therapy with me?
No. Okay. Yes. I love therapy with you. You are great. But
that's just because we laugh most of the time at like, how blunt we can be.
Yes. But I think when I like to go deep and I like to go hard and I like to get things done. And so that's probably why it gets really uncomfortable and I don't like it because it's like my body resisting, that whole experience. But in the end, I recommend it to all my patients. I think it's extremely helpful. Like people who don't do therapy, I don't know.
Who are you even?
Yeah. Who are you?
All right, Bisleen, what do you do that you don't like doing, but you do it anyway?
So, there's a point where I don't like doing some of my self-care stuff that I do like doing. So my situation's a little bit weird.
No, that makes perfect sense to me.
I love exercising, but do I want to do it every day? No. I love breathing and doing my breath work. Do I want to do it every day? No. So what I do, and something, that I work with my patients with, is we create a toolbox of strategies. And so this way, it's like, if you don't feel like doing something one day, then it's like you're doing something else, but it still falls under that same category. So it feels like you're still marking that off, if that makes sense.
So it's like self-manipulation. Yeah.
So
And
when you
that
guys,
makes, I like how it's left manipulation.
No, in a positive way. Okay. You don't know me that well, but like when I say the word manipulation, it's a good thing. We want to manipulate our psyches. We want to manipulate ourselves into success.
In that case, then yes.
Yeah.
And so, yeah, it's weird. I feel like there's not a single thing that I'm like, I know it's good for me, but I just hate doing it. I actually really don't have anything like that. But I will have days where like, you know, I don't want to exercise or I don't want to do my breath work, but I'll make sure that I'm looking into my toolbox and making sure at least I'm doing something to just take care of myself or just get me back in that place of feeling good.
I'm eager to talking about working out right now because like that for me. Yeah.
Can I, okay. How do you guys motivate yourself to do the things you don't want to do? Like what do you do? Because I've been hitting.
It's a great question.
Yeah.
Yeah. I actually just talked about this with a patient an hour before we got on this call. And when you have the mindset of this is the thing I want that's on the other side of that, you look at yourself and you go, I hear that you don't want to do this right now. And I acknowledge that. And there's a time and a place for that, but I'm also going to say no to that voice right now. And we were coming at it from a perspective of meditation because again, when I work with people on meditation, it's a little bit different as I don't do the guided meditation world. I don't ascribe to that type of thinking because I feel that people really need to learn how to sit with their shit as opposed to having that helping hand while they're moving through it. And I think that it's harder to motivate yourself when you're not clicking play on an audio, but instead you're saying, I'm going to sit in stillness for the next 20 minutes and attempt to focus on my breath. I would rather sit and scroll on the couch or, watch a Netflix or, do anything but this, or just get to work, but I'm going to choose to sit in stillness. And she kind of said to me, like, how do I get back on this train? And I say, well, do you remember how you felt when you were on the train? She was like, yeah, that's what's stopping me from starting again, because I am afraid I'll not get there. Or there's so much work required to get there. And I say, there's no work. Once you're in it, you're back in it. Once you sit and do the thing that you need to do, you're back in it. And I think people get stuck in the shame spiral of like, I'm lazy. Oh, I haven't done it. What's the difference? It's like you get into that all or nothing thinking and it stops you from doing the thing that you know is going to help you in the long run. And if you have that forward thinking of, if I do this, there is the potential that I'm going to see this happen on the other side. I think it remotivates and excites people. But we did talk about at the beginning, when something's a non-negotiable, it's a non-negotiable. When you commit to yourself, you commit to yourself. And you have I call it the shock collar or the elastic band on the wrist that says, when you want to do the thing and you go, nah, but you just go, bloop, nope. We're not listening to the voice, because once you start to train that voice that it has an opinion, it starts to give its opinion just as loud as yours. And you have to make that choice for yourself. Obviously, it's easier when you have someone motivating you, which is why people work with other people. But that is how I get through it myself. And I've caught myself sitting, being like, I don't want to do this. And then I hear the voice and I go, it's a voice and it said something, but I carry no merit to what this voice is saying. And I'm going to now do the thing that my mind initially set out to do. So it's a simple no.
Yeah, I resonate with that so much. I feel like there's no, it's simple. You do it. You do it regardless. You just do it and you take that action because you know it's good for you. And you went off track. Okay, cool. That's okay. Now get back on track and take that action. Because when you don't take that action, you're telling your mind and that voice that it's won. And this is all about reclaiming your power back. And the way you reclaim your power back is to then take that opposite action instead. And also, your behavior and your actions, you have 100% control over. Thoughts, you don't always have control over, right? So to kind of get that power, and it's true, you don't. I think it was my therapist who told me that emotions, you almost have like no control over ever, because you can get triggered and they can just randomly come up. Thoughts, you have like 50% control over, but then behaviors, you have like 100% control over, right? And that's where you get your power back from that awful voice in your head, is by controlling your actions and your behavior. Because
I'm about to flip this so fucking hard on your head. You're going to hate me after this, but please don't.
Okay.
What happens when the emotion causes the behavior, or if you choose the behavior, but it comes with emotion after? Right. And I think that that's a lot of where people get stuck in the, with anxiety and with depression, is like, they're like, yeah, I want to do that thing, but, And then they have the feeling that's associated with it. So like, I want to do it, but I'm so tired, I'm so lazy, or I want to do this, but I feel whatever. And the emotion you have no control over. So as much as you want to choose the behavior, and I'm just coming at it from the dilemma of the patients that I work with, is they want something different, but they can't implement it because the emotion is here and the behavior is just here. They're like, I want it, but this, right? So, and that's the dance of mental health. And there's days where you're going to feel strong and you're going to,
I think it's also just realizing too, right? Is like a lot of us are waiting to feel a certain way to take action. And I think it's about realizing that, you know, you're not going to, who knows, you might not even, who knows if you're ever going to get to that place of feeling good so that you can take that action. And it's about taking that action regardless. And then usually the feel good feeling follows, because so many of us are waiting to feel a certain way to feel good to take that action. Right.
Yeah,
and then of
that's
course,
my pet peeve.
You have to go deeper into that too, right? Looking at the thought, behavior, emotion cycle. Yeah. And then also looking at, right, if they are tired, fatigued, what is deeper going on at a physiological level? Like it's such a big umbrella and so many factors going on, you know?
Yeah. Usually what I tell to my patients to circumvent this cycle is you create intrigue. So I will say, okay, so you don't want to do this because of, you know, you want to do the behavior, but you can't because you feel this way, whatever. And I say, just do me a favor. I just want you to try the behavior and just tell me what you find. Tell me what you see on the other side, because the human psyche is like very interested, right? And if you place it in someone's hand as like, here is the action that's going to make you feel better. If you do this, you will feel that. And it's like, you say that to them. I think people lose their like, it's almost like losing your autonomy or your independence. You're like, well, how do I know that I'm going to feel that way? And I just remove it all. And I go, here's the thing. It doesn't matter what I tell you to do. If I tell you to hop on one foot, rub your belly and tap your head, whatever the fuck I say, you're going to do it. And you're going to tell me what you experience on the other side. And I want you to come back to me and tell me. Right. And that has been such an interesting thing when it comes to these self-care concepts, is you present it to someone and you say, okay, do it, try it, see. Okay. Instead of saying, you'll feel better when you start to do this. It almost is like a false guarantee. You can never guarantee that someone's going to feel better if they start working out, or if they go on their walks, or they start meditating, or they do their breath work. It's like, you have no idea. And it could go the totally opposite direction. And I always tell people that with anxiety and depression, when they start to do these things, I'm like, it could get worse at first. Highly likely it will. You're going to start to notice things and realize things, and it's going to make you burst a little bit. Your intellect is going to go poof. But we need to sit with that and what it brings up, because that's actually the lesson. The lesson isn't how do I get my heart rate down and how do I deal with situations better? It's like, how do you actually deal with the exact situation I'm putting you in right now? Because how you're doing this thing right here is how you do everything else out there. So let's use this as an incubator to see, do you have that motivation to stick with it? Do you have the curiosity to keep diving further toward it? So I think that when you stimulate the excitement around the thing, it keeps people interested. And it's like being on a ride instead of learning a task or learning a tool. It's like a self-exploration and learning how you're a very different creature than everyone else, and different things are going to come out, but you have to do these basic things in order to explore these concepts that you want to know the answer to so badly. Right? I don't even know where I just took that.
It was great.
Spirituality. Sorry, that was a very Buddhist monk statement, whatever came out of my mouth. Okay. Where were we going before about things that we like doing, things we don't like doing? Oh, right. I wanted to talk about working out as self-care. Because back in the day, I was like exercise junkie. Work out for your mental health, do yoga for your mental health, do all this for your mental health. Like I was like, go. No, not my microphone, go. So then when I started exploring all this nervous system stuff, I was like, this is interesting. This is one variable that I'm unwilling to let go of. What happens when I remove it? What happens when I turn this upside down and shift the way my body's experience things that I think are helping me when they're not? And I think there's a very fine line and a very beautiful dance to be done with working out and mental health. Mainly because of the motives that people have to do it, the addiction that comes with it, the hormonal wreck that can come with it, the there's just so many concepts to talk about. And I've been on both sides of the spectrum where I have been go, work out all the time, do all the things, and then gone to the completely opposite side of the spectrum where I spent a year only walking.
Oh, you actually walked. I did nothing.
I did not let my heart rate go above, I believe the number was like 130 for a year. And I felt amazing, so amazing, and interestingly to the point that I now have started incorporating exercise back into my schedule, but only do it a certain number of days per week if my body permits. Like I will actually assess how I'm feeling after the workout, which is never longer than 25 to 30 minutes. And I assess how I feel after. If I am dead, then there's no more working out that week. If I feel okay, I'll let myself work out one more time. And if I'm feeling, amazing, which never happens anymore, my body has taken like a total 180 flip once its hormones started regulating properly. And I'm not talking about female hormones for anyone listening. I'm talking about like my cortisol and my melatonin, like my actual circadian rhythm cycle, which is very, very relevant for mental health. My body started changing and it started feeling things differently and reacting differently. So I think there's a lot of people out there that think exercising is really helpful for your mental health, but I think it has to happen in a way that's in alignment with your body and the symptoms that you have. And I go over that in my program, which is such a big spot of resistance for people. It's like letting go of this. And I still have patients who are like, I'm just not letting go. And I'm like, okay, that's fine. Like of course you can consent to make any decision you want. But if you're looking for the result on the other side of this and you're not willing to let go of this and you've done everything else, like how much more convincing do you need that this sticky spot needs to maybe access some Glucagon, right? It's very fascinating to watch people work through this, especially with this. Yeah, you talk.
Well, I think that's a very valid point too for like the group of people that you work with, like type A's. It is like I'm the same way. Like I will work out for like 3 hours a day if it's supposed to be healthy, and kill myself. Meanwhile, that is not good for my sex hormones. That is not good for my cortisol and my melatonin. And it's like, there is something about over exercising and under exercising and finding that balance. Because same like with my patient population with fertility, it's the same thing. You can be under exercising or over exercising, and that is going to affect your hormones. Like it is
mental health, and that is huge.
But also too, like it's going to affect your nutrient status, because if you are like sweating your brains out every single day, like you're losing very important water soluble vitamins, like the B vitamins that are, much needed for your mental health. Also like minerals, magnesium, calcium, like all those things are being sweated out. Is that a word? Sweated out.
Yeah.
And so if you're not repleting that properly, if you don't have a good diet, if you're not hydrating properly, like all these things come into play. And it's that balance, right? Like, are you like over exercising isn't a good thing either. Just like,
And I think just also you brought up a good point, Jenna, because the way that you've exercised has changed and transitioned in your life. And I think a lot of us don't realize that too, right? Certain periods and stages in our life, like it's going to differ, and that's okay.
Yeah.
Right.
You want to know what's interesting too, is like at a younger age, that was saving my life. I was looking at the exercise as like the way it was like my outlet, and I could let out my anger and my sadness and my grief. And like, I became addicted to the feeling of the release of the hormones and the dopamine and the endorphins. Like the only time that I could feel good was when it's like a drug. Right.
And then you got old.
Yeah, but then
your body can't handle it anymore. With the most respect and love.
No,
but like, you know what I mean?
Yeah, but you take that. Yeah, but you take that mentality. You take that mentality, and you look at your mental health later on, and you go, "Well, that's the thing that saved my life, so I can't let it go." right? Yeah. So now there's the physical addiction and there's the mental emotional addiction to the thing. And yoga became that for me too. I was like, that is the thing that fixed me. And I became so like obsessed with the feeling of the hour of feeling fixed. And it was like, I would do 2 or 3 yoga classes a day because I wanted the feeling of feeling good. And it's literally the same thing as drugs and alcohol. And until you wrap your head around that and build a new relationship, and this is only going to land for some people because not everyone's in this situation, but when you start to dance with that idea, you're like, oh, that's interesting. There's more happening under these layers of the mental health stuff. And I think that is where self-care sometimes it gets confusing because you're like, I'm doing this for my health, but is it also a detriment to my health at the same time? I don't know. And I will say to people, let's find out. And they go, fuck no. And I'm like, why? Right. And I understand the pathology behind that, but I'm looking at them saying, just give it a shot. Nothing bad will happen. Just give it a shot. You might be pleasantly surprised what you see on the other side. But I can only say that because I did it. And again, it took me years and years and years to finally be like, okay, take me. Like I was like, so attached to this stuff. So I get it. So if anyone's listening and you're like wondering if that might be a part of the picture, it might be a part of the picture. So yes, that is something that I definitely wanted to cover. Something else I want to talk about is what doesn't cut it as self-care that people are labeling as self-care. I'll let you sit on that for a second and think about it. So like, what do people be like, oh, I'm going to go do my self-care now. And then you're like, that's not self-care. Or like, that's not helping your mental health, or that's not doing anything for your anxiety and your depression. Like from an actual treatment perspective, obviously, you know, being like, oh, I'm having a movie night eating popcorn. Like, yeah, I get self-care. Like I get that. Like the concept is I'm doing something I like, but what are people labeling as self-care that's actually not contributing that much to their mental health? From a diagnostic perspective, not like being stress-free. You know what I mean? Like people are like, oh, I have anxiety and I do this. And I'm like, well, obviously it's not going away. What you're doing isn't doing anything, right? I'll let you be savage. Take your time.
That's a tough one.
Yeah, that is a tough one. I feel that. Yeah, I'm just like,
I feel like it's very individual. And I hate that answer. Like it depends.
Ew.
Yeah. But I think it does because like anxiety, depression, like there's a spectrum and you can be like on your way and getting better and doing all the things. Or you could be just starting and still trying to figure out where you're at and what works for you. So I think when it comes to self-care, there's a lot of trial and error. Jenna, like you were saying, like with the whole exercise, situation, like it took you years to figure it out. And I think self-care, just like, managing your anxiety, it's like, it's an evolving thing. And the things that you might've done when you were younger might not be what you need right now. And so I think it seriously depends on where you are, where you're at in your journey. For me, at least, that's what I think. And I'm right. No, I'm joking.
Play it safe. Play it really safe. Let's not offend anyone who might listen to this.
It's true.
I feel like, again, it is a difficult one to realize because in a way, Catherine is right. Like it's so individual, something that I would consider like, that's not self-care. Someone would be like, I feel amazing after that. Right. So, I mean, in a way, like self-care can be anything. I don't know. Like, right. It can literally be anything. Right. Because everybody's just so different. And it just, I feel like it just,
let me push you guys to what I'm kind of looking for here. Because of course, self-care is going to be different for everyone. We all have different enjoyments, different hobbies. If someone came to you and said, I'm working on my anxiety by doing blank.
Okay.
And it's not getting better. Have you guys had people reach out to you being like, listen, I'm doing all the things, like I'm doing this and I'm doing that and I'm doing that. but I'm not seeing any benefit. Like, what are people doing? Like, for example, I will give you a savage example. Again, something I love to do. Okay. I love washing my face. I love face care. I love gua shaing my face, but that's not contributing to reducing my anxiety condition. It's not improving my depression diagnosis. It's washing my face and gua shaing my face. Right. So when someone comes to me and they go, listen, like, I'm doing everything that I need to, like, I get up and I'm like, I'm going to work and I'm coming home and I'm like taking a shower and I'm washing my face. And like, I listen to a 5-minute YouTube meditation. I'm like, nothing's getting better. And I'll savagely be like, what are you doing though for your mental health? Like, gua shaing your face isn't going to help. And I hate to be a dick. No, I don't actually. I love being a dick. But there are things that we actually need to be doing for our mental health that we know, like even research is like here are some really good tools to use, right? Something that has come to me more in my inbox as of late will be like, I am going to a tapping class once a week. Okay. So they're going on Zoom and they're doing, like the tapping, right? And I'll be like, that's a great start, but that's not like your self-care routine. This isn't going to make strides with our anxiety and depression because you're tapping meridians, right? And I think that that's where my opinion is so different than so many people, because everyone's like, yes, like you're doing something, it's good for you. Like, great, go, keep going. Like, do what you got to do. And I think that I land myself with a lot of patients who are like, I've done all this stuff and I've done the trendy stuff and I'm doing all these things, but like nothing's changing. And I'm like, okay, where are the actual hard things that you're doing a part of your day that are a part of your self-care routine? Or where are you challenging yourself? Because I got to be honest, like doing this to your forehead for 5 minutes a day, even half an hour a day, is not going to change your anxiety point blank. And I think that we are in this odd spot of being practitioners who want to empower people and want to be like, yes, you got this, keep going. But at the same time, we have to look at people and be like, that is not enough work to throw in the towel and say, I've done everything. My anxiety and depression isn't going away. And I look at them and I'm like, don't give up. You literally haven't started. Right? So well, you both went solemn when I had that whole conversation. So what happened through your mind when I said all of that?
I think, don't know. I need to eat something. My brain is shutting down.
Catherine, I feel that dinner is happening. But it's actually interesting. I actually don't. A lot of my patients are people who just are just getting into this and they're like, I just want to try the natural route. So it's interesting that you bring up. And I think I probably have like 1 or 2 patients where they've tried a bunch of things, nothing's working. And really the reason for that is because they're just missing a strategic plan and to connect the dots.
Yeah. I would say a lot of people come to me when they're like, they've done a lot of things and they're at their wit's end. They've done what everyone else has told them to do. And they're like, nothing's working for me. So I think I end up working with a lot of the people who like the lessons haven't landed. And I work with a specific type of person, right? I work with hard-headed people who like have a similar personality to me. That's what I draw in, is people who just think differently about stuff. But it does, like, obviously people are coming to me the same way that you have patients where it's like, they haven't really tried anything, but they come to you in that despair state. But they're like, listen, like I meditate, like it's not working. And I'm like, listening to someone say, calm your mind and relax your face and let go of your shoulders for 10 minutes is not a meditation, in my opinion, when it comes to mental health. Because what I work with people on is not how do I make you chill out in the moment? How do I actually teach your body and your mind to do hard things, to shift your perspective, to feel things differently, to learn how to experience yourself in a different way? And we can't do that while someone's tickling our back. We can't do that when someone's helping us go to sleep. We have to face the things that come up and actually sit with our shit and learn how to move through it. And I think that that's a hard lesson for a lot of people to learn. It's not for the faint of heart. it's deep and it's hard. But I think that my biggest frustration as a practitioner is people coming saying that they've done everything. I'm like, you have not.
Well, and also like, how long have you done it for?
Correct.
Have you been consistent? And like, have you been doing it consistently every day for how, like this many times?
Yeah.
And I think the problem with how self-care has been positioned everywhere, especially like, you know, all the trendy social media things and like, you know, everyone just talking about it, is that it's like a self-soothing type of thing.
Yeah.
And Jana, like what you're saying is like, no, it's not always going to be like, oh, like I love this. Like, it feels so good. No, sometimes it's going to be annoying. Sometimes it's going to be hard, but you need to do it so that you can get the benefits after.
I'm dying. One of the guys I'm working with right now, just in quotations, goes, I bought relaxing scented incense I burn before bed, but I'm still anxious. And this is actually really funny when this comes into my inbox. Someone will be like, I put lavender oil, like, you know, in my diffuser before bed. I'm like, so?
And
I'm like, are you eating the plant out of the diffuser? Like, you know, and ingesting, you know, the right dose of that many capsules before you go to bed from the actual plant, or are we sniffing oil? Because if we're sniffing oil, again, I cannot guarantee anything's going to happen.
It's lovely,
like,
but
yeah, it's the same thing as singing Kumbaya out of the sky and being like, I feel better now. But like from a long-term perspective, we are not seeing results on the GAD-7 reduce because, you know, you waved some sage over your head, right? And that's where I get lost on some of the people when I connect with them, is it's like, what do I have to do to convince you that you haven't done anything yet? So I don't want you to give up. It's not a negative message like you suck because you haven't done the right things. It's like, don't give up on you getting better or feeling different, because the things that you're doing are like short-term coping mechanisms and tools and band-aids and like, you know?
I think also like these things, right? Like burning the incense and stuff. I think so much of this stuff has been glamorized by social media, right? And people are trying all these things.
Social media,
right? It's true. Like, how nice is it to make, like, if I made a video on me putting incense and be like, yeah, self-care, right?
I'm
and like a nice
free.
little background, right?
Yeah.
And so I think that's where everybody's also so misconstrued about what works for anxiety, what doesn't, because imagine how many bloggers and influencers probably were like, oh my God, I love this lavender spray, or like, oh my God, this oil is so great, and my anxiety goes away, right? And it's just like,
I
that's a big
sage.
reason I feel like as to why too people are like, oh, I'm trying all these things, but nothing's working, except everything they ever tried was because of some blogger from Instagram with zero credentials in mental health. You know?
Yeah.
Just
or
like level band-aids.
We can even like extend that to plant medicines, but like before we move from that topic, I love sage. Sage is my face product line that I love using on my face, but I cannot handle one more person saying I put lavender oil from like sage, whatever, on my arm or like the roll on, and like it didn't help my anxiety. I'm like, duh. Right. Okay. Moving on to Shiznat. I lost my train of thought.
Plant medicine.
Plant medicine. Yes. If someone will be like, oh, I tried ashwagandha tea and it didn't help me. And I'm like, who told you it would? Right. Or it's like, I tried gummies that had like mushrooms in it and it didn't help. And I'm like, why would it? Like, there's so many things that are like marketed out there being like mood control. And it's like a pill that has like 2 milligrams of chamomile in it. I'm like, okay, like my dog can eat that and like literally not miss a bark. It's so lost on me, like, where is this information coming from? And I feel like I'm working so hard constantly to explain to people that there's like research and professional products and dosing that's required for medication. It's like, why are we like, okay, Zoloft should be taken in 125 milligrams, but suddenly I can take any plant medicine and it absorbs through my skin in an oil and my brain should be better. I'm like, huh? How does this discrepancy of cognitive dissonance occur in society? Like, social media. If that was the case, like, why are you guys popping Xanax and Zoloft and sertraline and escitalopram, and like, why aren't you guys rubbing it on your wrist? Why aren't you sniffing it in the air? Right? If mental health is like a condition that we're working with, then we need to start really looking at it that way, instead of thinking that we can clap our hands, tap our temples, and like sing Kumbaya and throw our hands up to the sky and be like, and now I'm healed. It's like, nah, this is a life diagnosis that you're going to work with. And there's going to be real work required on the other side of whatever feeling different is to you. And it's just such a powerful lesson that I want people to walk away with, which is like, if it's not hard, it's not doing anything. I cannot stress enough how much hard work I have put into my mental health over the years of working with it, of trashing what I was doing and then restarting and rebuilding and trying something different and building different perspectives and learning more information and trying these things. My AirPods are dying. But I did it I did it so many times where I'm like, stop giving up. Stop giving up because the one way you tried didn't work, because nobody likes that attitude. We want to build each other up and feel the empowerment and recognize that things can change when you start to make change, not when you sit in that mindset of nothing will ever get better for me, because it's just a frank lie. Did I yell?
And that was great. I feel like that's like,
end scene.
Yes.
Right. Well, I mean, my AirPods are dead and I'm sure the other one is going to die very, very shortly. Does anyone have any questions before we go? I did not field any questions throughout our time together. I don't have so many people coming in through at the live right now, but if you do have questions and you're listening to this after, feel free to send a message. If you felt something I said called you out and you're like, ugh, I didn't like hearing that, that's cool. Let's have a conversation about it. Being called out is like the beginning of something really, really beautiful. It's not the time for you to shy away and shut down and go, oh, I don't like what that person has to say. It's like, if something's triggering you, it's the moment for you to unlock and see what's inside of there that's causing you to have that emotional reaction and go, I wonder what I see within myself inside that statement. I wonder what I found uncomfortable about it. And let's have conversations about it, because those are the best ones to have. Literally why I call Catherine. I'm like, let's have a savage conversation today. I know it's just Thursday, but let's do it anyway. Right? And that's what we do. That's how you grow. You grow by shifting how you perceive, and it will change how you think. And in turn, it will change how you feel. Okay. So let's park it there unless we have anything else good to come out of you two. I mean, I'm sure there's still things lingering within.
That was an amazing.
No, that was well said. I'm
all right.
Starving, and it's time for my self-care now.
Amen.
I already completed mine for the day, so I'm gonna head over to the couch and watch a TV show, which has become a part of my self-care, because I used to not be able to do that. If you've ever heard me talk before, you know that I had no freaking chill. I'd be like, yeah, I'm chilling on the inside. I was like, okay. But now I can actually chill and watch TV, which was a very lovely thing to learn about myself over all these years. All right. So I hope you all have a lovely evening. Enjoy your dinner.
Thank you.
For those of you who joined me live, thank you so much for staying, for adding to the conversation. And for anyone who, again, is listening to this after, feel free to shoot me a message and let's get chatting. All right. Peace out, you two. Farewell. Bye. Thanks for the combo. And let me know what you want to chat about next, because that was fun.
Okay. Bye. Take care.
Bye, guys.
Bye.
Bye.